Did you know that while some meats are full of compounds that actually help you live longer and stronger, others can subtly accelerate the aging process in your cells? Hello, I'm Dr. Leila, a board-certified medical professional with a focus on nutritional geriatrics. I've devoted my professional life for more than 15 years to learning how our diet affects aging, particularly for people in their prime. I have personally seen how small dietary decisions can change people's lives, transforming weak elderly people into active, self-sufficient adults. Before we begin, click the subscribe button and leave health in the comments if you're prepared to empower your body and improve your health. Together, let's set out on this adventure. The foods we eat every day after the age of 60 have a significant impact on our heart health, brain function, and muscle strength. They are not just choices based on taste. Fueling our bodies to thrive rather than just survive is more important than simply satisfying our cravings. Based on international research confirmed by regulatory agencies such as Anvisa and the most recent data from Brazil's Ministry of Health, we know that some animal proteins can significantly increase the risk of developing chronic illnesses. For example, extensive epidemiological studies conducted throughout Brazil reveal that eating certain meats on a regular basis can increase the risk of heart attacks or strokes by as much as 56%. Not to be overlooked is sarcopenia, a progressive loss of muscle that affects roughly 30% of older Brazilians. It can take away your freedom and mobility and is frequently sped up by processed meats. Consider this. As we age, our bodies naturally change. After age 40, our baseline metabolism slows by about 1% annually, making it more difficult to burn off calories. At the same time, we are exposed to harmful substances in ultra-processed foods for longer periods of time because our liver and kidneys, which are essential detox organs, are not functioning as well. Our digestive system also changes. Fewer enzymes, a changing gut microbiome, making it harder to digest complex proteins and absorb essential nutrients. Because of this sensitivity, seniors are especially at danger from eating low-quality meats. The good news is that we don't have to completely avoid animal proteins. They are essential for maintaining mental acuity and healthy muscles. Rather, it is about making well-informed decisions that promote active aging. The good news, no matter your age, even minor dietary changes can reduce inflammation, improve metabolism, and increase immunity. When we provide our bodies the proper resources, they have a remarkable ability to regenerate. To demonstrate this, let me tell you a story from my clinic. A 68-year-old guy called Roberto once came in feeling worn out and struggling with high blood pressure. Convenience foods made up a large portion of his diet. And following some blood tests, we observed obvious inflammation. We changed his situation by pointing him in the direction of higher protein foods. He resumed walking his grandchildren to school, regained his vitality, and stopped using his medications. His story serves as a reminder of how important this is. Let's now discuss meats that we should avoid after the age of 60, starting with processed sausages and cured meats such as mortadella, ham, salsichas, and linguiça. These Brazilian culinary mainstays may bring back happy memories of backyard cookouts, but they really endanger the health of elderly people. Packed with nitrites and nitrates, which are preservatives that keep them looking fresh, these can cause your body to produce nitrosamines, which are chemicals that have been linked to cancer, especially in the digestive tract. This is supported by research from the Brazilian Society of Geriatrics and Gerontology, which found that seniors who regularly eat them have a 36% increased risk of colon cancer based on data from the National Cancer Institute, INCA. Furthermore, the Association of Brazilian Nephrology cautions that these compounds put undue load on kidneys that are already aging. Additionally, a single slice of ham can contain over 400 milligrams of sodium, which is about a quarter of the daily limit for people with hypertension. According to the Brazilian Society of Cardiology, this can exacerbate heart failure by causing fluid retention, limb swelling, and blood pressure rises. These items' saturated fats increase LDL cholesterol, the bad sort, which encourages the formation of arterial plaques. This accelerates atherosclerosis in older adults whose blood arteries naturally lose flexibility, increasing their risk of heart attack and stroke. These meats can worsen renal failure if you have kidney problems, which affect almost 25% of Brazilians over 70, according to public health data. This is because aging kidneys cannot handle the chemical load and additional salt. I've met patients in my clinic like Maria, a 72-year-old widow whose edema and exhaustion were exacerbated by her daily ham sandwiches. When she switched to natural alternatives, she felt lighter and had more energy. What should I replace? Extra virgin olive oil drizzled over chickpea spreads, fresh eggs, or herb-seasoned shredded chicken. These provide protein and taste without the risks. Now let's talk about deli meats and other processed foods like roast beef, salami, and turkey breast. For people over 60, these store conveniences can be dangerous. They go through extensive industrial processing, which includes the addition of inorganic phosphates, which overwhelm kidneys that are already less effective, according to studies from the University of São Paulo. According to Ministry of Health statistics, osteoporosis affects over 30% of Brazilians over 65. Excess phosphates also prevent calcium absorption. These also contain hidden sugars such as corn syrup or dextrose, which raise blood sugar levels and cause long-term inflammation linked to type 2 diabetes. Seniors who eat them 3 or more times a week had a 45% increased risk of insulin resistance, according to a multi-center study conducted by the Brazilian Diabetes Society. The connection to brain health is particularly concerning. Seniors who consumed a lot of processed beef experienced a greater rate of cognitive loss, according to 8 years of tracking by UNIFESP researchers. These nitrites combine to create nitrosamines, which enter the brain and harm cells. According to Heart Institute studies, the high sodium content, typically half your daily intake in a single sandwich, increases blood pressure and oxidative stress in people with diabetes or hypertension, raising their risk of stroke and speeding up dementias like Alzheimer's. I remember a 65-year-old patient named João, whose family was concerned about his memory lapses. He ate a lot of deli turkey, but his cognitive assessment significantly improved after switching to homemade shredded chicken or egg-based choices. My passion is fueled by these real-life transformations. Seniors should also avoid fried chicken, especially from fast food restaurants. Trans fats and lipid hydroperoxides, which are pro-inflammatory villains, are produced when it is dipped in refined vegetable oils, such as soybean or maize, at high heat. According to research from the Brazilian Cardiology Society, eating fried food on a regular basis increases the risk of cardiac events in people over 60 by 35%. This low-grade inflammation has a devastating effect on the heart. Additionally, it inhibits the production of muscle proteins, exacerbating age-related muscle atrophy. Frying creates advanced glycation end products, AGEs, which are toxins that accelerate visible aging by stiffening arteries, deteriorating joint cartilage, and breaking down collagen and elastin in the skin. The pancreas is strained in diabetes due to blood sugar fluctuations brought on by oxidized lipids and refined breading. According to the Ministry of Health's Vigitel surveillance, seniors who eat fries 3 times a week have a 40% increased risk of insulin resistance. Visceral fat is added by calorie density, which restricts freedom and mobility. Think of eating fried chicken as clogging and slowing down a well-tuned engine, much like putting sludge into it. In my geriatric clinic at Hospital das Clínicas, I've suggested that patients use natural spices to bake, broil, or steam instead. Within months, Anna, a 67-year-old lady, reported improved energy and fewer joint discomfort after switching from fast food fried chicken to herb-grilled varieties. Care should be taken with even apparently healthy skinless chicken breasts from industrial farms. Growth promoters and preventative antibiotics are frequently given to Brazilian chickens. Traces are found after cooking, according to Anvisa surveys. This prolonged exposure impairs immunity in elderly people whose detoxification processes are slower. According to studies from the University of São Paulo, seniors who consume industrial chicken 5 or more times a week are more likely to experience respiratory and urinary infections because drugs alter the gut flora, which is responsible for 70% of immunity. Although it is beneficial for weight, its low-fat content prevents fat-soluble vitamins like A, D, E, and K from being absorbed. Osteoporosis threatens if vitamin D is not present. Diets high in chicken have caused suboptimal levels in my clinic, which has resulted in bruises, dry skin, brittle bones, and poor healing. Choose Ministry of Agriculture certified organic or free-range chicken to make it work. Add the thighs for good fats, or serve the breast with avocado or olive oil. This guarantees the benefits of protein without nutrient shortages. After I suggested this change to Carlos, a 70-year-old patient, his infection rates decreased and his vitamin levels returned to normal. Moving on to the good stuff, meats that promote longevity beyond the age of 60. Among the proteins, grass-fed lamb is particularly noteworthy. Public health services underdiagnose many elderly despite the fact that it is highly absorbable and packed with heme iron to combat anemia. As people age, zinc slows down the healing of wounds and strengthens immunity. Red blood cells and myelin sheaths are supported by vitamin B12, which protects cognitive function. Compared to grain-fed lamb, pasture-raised lamb's omega-3s better regulate inflammation, reducing the risk of heart disease and arthritis. For a balanced protein-fat ratio, choose cuts from the legs or shoulders. Turn collagen into joint-friendly gelatin by slow roasting it with thyme and rosemary. According to research from the University of São Paulo, eating 150 grams twice a week increases grip strength, a crucial indicator of muscular health, by 8% in 6 months. Research published in the Brazilian Journal of Nutrition shows that replacing processed meats can reduce cardiac risks by lowering C-reactive protein. Add vitamin C-rich vegetables, such as peppers or kale, to improve iron absorption. Apply olive oil and fresh herbs for a powerful anti-inflammatory effect. I've found that patients who include lamb in their diet report feeling less tired and having more mental clarity. For example, Sophia, 69, cut her arthritic flare-ups in half after adding lamb once a week. For seniors, duck is a nutritional treasure that is sometimes disregarded in Brazilian diets. The antioxidant selenium, which protects cells from oxidative damage, is abundant in free-range ducks. According to research from the Geriatrics Society, its heme iron helps fight anemia, which affects up to 30% of older Brazilians, particularly women, and reduces weariness and lightheadedness. Duck fat has a monounsaturated composition similar to that of olive oil, which supports brain function and keeps arteries flexible to reduce the risk of hypertension and stroke. When roasted with the skin, it provides vitamins A, D, E, and K for immunity, bones, and eyesight. Vitamin E prevents the aging of tissues. Eat every 2 weeks, removing extra fat but leaving the skin on for moisture, and herb roasted, such as with rosemary. If you want calcium synergy, pair with dark greens. When my 74-year-old patient Pedro began doing this, he reported stronger bones and fewer colds, demonstrating the underappreciated power of duck. For those over 60, sardines with skin and bones are a nutritional powerhouse. They contain more bioavailable calcium, 900 milligrams per 100 grams than milk, along with vitamin D for bone fixation, which reduces the risk of osteoporosis and fractures. Soft bones give skin and joints collagen. Research from the University of São Paulo shows that eating small fish reduces joint pain by reducing inflammation. According to the Brazilian Geriatrics Journal, twice-weekly consumption of omega-3 fatty acids, EPA-DHA, slows cognitive decline and improves memory. They reduce heart problems and systemic inflammation. Soft texture facilitates digestion, low mercury makes them safe. Steer clear of soybean oil and opt for antioxidant-rich olive oil. Eat it grilled, in pâtés, or in salads 2 to 3 times a week. Small fish are advised by public health to prevent chronic diseases. I've witnessed patients like Lucia, 71, flourish. Her energy levels increased and her bone density increased. For elders, grass-fed beef liver provides nature's multivitamin. Vitamin A is essential for skin, immunity, and vision. 100 grams provides daily protection against dryness and vision loss. A 25% shortage in B vitamins, particularly B12, prevents anemia and dementia in senior Brazilians. It increases zinc and iron for flavor and healing. According to data from the University of São Paulo, weekly intake increases iron, reducing the 30% anemia rate in people over 70. To control flavor and retain nutrients, quickly sauté with olive oil, onions, and herbs like sage. Due to cholesterol and vitamin A limit to 1 to 2 times a week, it contains purines and vitamin K, therefore consult if you have gout or blood thinners. For problems with chewing, prepare pâtés. Elena, a 66-year-old patient, recovered vitality after receiving liver and reversing her B12 deficit. For good aging, variety is essential. Research from the Geriatric Society indicates that a variety of animal proteins enhance muscle retention and body composition. combine for complete amino acids and vitamins, red meat for iron and zinc, fish for omega-3 and D, and chicken for easily digested proteins. Choose sustainable, organic, and fresh sources. According to Anvisa, these have superior fats and fewer hormones and antibiotics. Lean red meat 1 to 2 times, skinless poultry twice, offal seafood once, and deep water fish twice a week. Put plant proteins inside. To preserve nutrients and stay away from carcinogens, prepare by steaming, baking, grilling, or sautéing. Add turmeric and other anti-inflammatory spices. These are broad recommendations. Discuss them with your physician or dietitian, particularly if you have kidney problems, gout, high blood pressure, or diabetes. Use the free nutritional advice provided by Brazilian Public Health. In my role as Dr. Leila, I have witnessed these shifts inspire happiness and self-reliance. Start small, and your body will appreciate you for it. You can do this. What is one change you plan to try? Let's discuss it in the comments. Remain well.